Hello, my name is Dr. Bill Agel, and I'm an OBGYN and the Chief Medical Officer here at Cape Cod Hospital. We're excited to support you along your breastfeeding journey and to help you meet your goals. We have earned the prestigious designation of baby-friendly, originated by the World Health Organization and considered the best practice for mother and baby care relating to infant feeding. This video will provide you with information about the benefits of breastfeeding. We will support you during your pregnancy, your hospital stay, and beyond that. The Family Birthplace will give you all the information you need, confidence, and skills to successfully initiate and continue breastfeeding.
Hello, my name is Carrie Thompson, and I am the Nurse Manager of Women and Children's Services at the Family Birthplace. During your prenatal visits, you will be provided with information about the 10 steps to successful breastfeeding through handouts and electronic technology like our Family Birthplace app. You can also find information about our prenatal education classes at Cape Cod Hospital, as well as local community resources on Cape Cod. We know this will help you make informed choices about feeding your baby.
Hello, my name is Dr. Jeff Schreiner, and I'm a pediatrician here at Cape Cod Hospital. I'm here to speak with you about the recommendations for breastfeeding. Breastfeeding and human milk are the normative standards for infant feeding and nutrition. The short and long-term medical and neurodevelopmental advantages of breastfeeding make breastfeeding or the provision of human milk a public health imperative. The American Academy of Pediatrics, or the AAP, recommends exclusive breastfeeding for approximately 6 months after birth. Furthermore, along with appropriate complementary foods introduced at about 6 months, the AAP supports continued breastfeeding as long as mutually desired by mother and child for 2 years or beyond.
Hello, my name is Dr. Holly Zen, and I'm an OBGYN here at Cape Cod Hospital. Today I'm going to talk to you about the benefits of exclusive breastfeeding. Breast milk is the perfect food for your baby. It is easy to digest, and babies often have less GI issues. The benefits of breastfeeding to your baby's health are less risks of ear infections, type 1 diabetes, SIDS, otherwise known as sudden infant death syndrome, asthma, childhood leukemia, and obesity, just to name a few. Mothers also have health benefits from breastfeeding, which include reduced risks of breast cancer, ovarian cancer, heart disease, and type 2 diabetes. Breastfeeding also helps you return to pre-pregnancy weight and health faster. I would also like to explain the risks of giving your baby anything other than breast milk if you are a breastfeeding mom. Formula should be given only if medically necessary. We would support and encourage you to latch and breastfeed first. If your baby requires supplementation, the staff will help you hand express and feed colostrum, then pump for further stimulation and potential collection. We would show you how to feed this with a spoon or feeding syringe. Here are some of the risks of giving formula. Baby will be less content on the breast. Your baby may be more susceptible to illness. It may reduce your milk supply, and it may decrease your confidence.
Hello, my name is Maddie Summers McNary, and I am a certified nurse midwife here at the Family Birthplace. I'm going to talk to you about the importance of safe skin-to-skin. Did you know that skin-to-skin contact within the first hour of life is important for all babies? Skin-to-skin is when your baby is placed on your naked chest immediately after birth. With this first hug, your baby will smell you, hear you, stay warm with you, and you will get to know your baby and be able to respond to your baby's feeding cues. We recommend you keep your baby skin-to-skin for at least an hour after birth or until the first feeding. Skin-to-skin is important because it helps mom and baby bond, stabilizes baby's vital signs, helps keep your baby warm and calm, stabilizes baby's heart rate, respirations, and blood sugar, and helps with baby's first feeding. We encourage you to do skin-to-skin frequently. It's important to be safe when doing skin-to-skin. You must be awake and available to focus on your baby. It's important to avoid distractions such as TV, phone, or visitors when doing skin-to-skin. Our staff at the Family Birthplace will assist you to do safe skin-to-skin. To start, position yourself in a semi-reclined position, undress your baby down into just a diaper, place the baby nipple line to nipple line with you, with arms and legs flexed. Turn the baby's head to one side so you can see the baby's mouth and nose at all times. A blanket will be placed over you and your baby and tucked under your arms.
Hi, my name is Kylie.
And I'm Heather, and we're nurses at the Family Birthplace, and we're here to talk about rooming in. Rooming in is when your baby stays with you 24 hours a day throughout your entire hospital stay. This is one of the best ways to get to know and care for your baby. While rooming in, examinations, vital signs, baths, and testing will be done for your baby in your room.
At Cape Cod Hospital, we practice rooming in so that you can learn your baby's feeding cues, build your confidence, feed your baby on demand, learn how to care for your baby, and help your baby learn to recognize you. Rooming in will help your baby cry less and mothers sleep better.
Hi, my name is Dana, a nurse here at the Family Birthplace, and I'm going to talk to you about feeding on demand. It's important to feed your baby whenever your baby shows signs of being hungry. There are many benefits to doing this. It helps your baby to be settled and content. It helps prevent breastfeeding complications. It helps you to have a good milk supply, and it helps your baby get just the right amount to eat. We recommend feeding 8 or more in 24 hours, and always watch your baby, not the clock. Here's a picture of some cues you might see from your baby to show hunger. We encourage you to initiate breastfeeding within the first hour of life. The staff here at the Family Birthplace will assist you in doing this. The first milk is called colostrum. It's full of nutrients and antibodies that are uniquely designed for your baby. Babies will start having more frequent feedings on day 2 of life. This is normal. There should be no time limit on frequency or length of the feeding. You will be taught how to recognize when your baby swallows in order to know your baby is drinking. The more frequently you nurse your baby, the more milk your body will produce.
Hello, my name is Lynn Cedroni. I am a nurse and the staff educator here at CCH. I'm going to talk with you about the importance of positioning and the asymmetric latch. Proper positioning and latch are key elements for breastfeeding success. It is important to get an asymmetric latch. This helps your baby get the milk they need and prevent sore nipples. Practice and patience are key elements for success. Some things to remember to achieve an asymmetric latch are position your baby tummy to tummy, nose to nipple, and bring the baby to the breast. In this picture of common positions, you can see the baby's ears, shoulder, and hip are all in alignment. During your stay here at the Family Birthplace, our staff will educate you on proper positions and latch. They will help you identify swallows and how to hand express. Upon discharge, you will receive a personalized feeding plan. This will include outpatient lactation support at CCH as well as our community resources. Support is the key to achieving your breastfeeding goals.
Hello, my name is Heather.
And I'm Diane. We are internationally board certified lactation consultants at Cape Cod Hospital. When delivering at Cape Cod Hospital, please ask for help with breastfeeding from our extensively trained nursing staff. While here at the Family Birthplace, we are available to see you and help you initiate breastfeeding.
When you go home, we provide lactation support 7 days a week through our lactation warm line and our one-to-one visits at Cape Cod Hospital. Here at the Family Birthplace, we provide free hands-on help at our breastfeeding clinics located at Cape Cod Hospital and Falmouth Hospital. You are not alone when you go home.
Hello, my name is Elisa Krieger DeWitt, the childbirth educator here at Cape Cod Hospital, and I would like to conclude with thanking you for viewing this video. If this video has brought up any questions or concerns, please talk to your provider at your next OB visit. We hope this video has provided you with the information you need to make an informed decision when deciding on how to feed your baby.